2013 and what they expected to have provided if they kept to the Abuja declaration of 15%. You see the variance. All through the 4 years, we've never met the 15%, and averagely, we were doing 5.30%, which is more or less 1/3 of what we were expected to provide. And in that same page, if you look at table 2, it shows you that even the little money that we set aside for capital budget, that we are utilizing an average of 41.14% of it over the 4 years. So even the little money that was set aside was not fully released. And where it was partly released, the one that was released was not fully cash backed, and even the little that was cash backed was not fully utilized. So there are a lot of challenges which we need to take into consideration. So in view of all that has been said, the CSOs working in the health sector hereby put forward the following recommendations. 1, increase allocation to the health sector to reach the 15% Abuja Declaration benchmark. And the bulk of these new resources should go to capital expenditure to enhance access to equipment and health supporting infrastructure. 2, the full implementation of the National Health Act, especially setting aside the 1% of the Consolidated Revenue Fund to the Basic Healthcare Provision Fund. In this regard, we order the guidelines for the administration, disbursement, and monitoring of the fund should be designed to reflect the provisions of the National Health Act. 3, increasing the efficiency of health sector spending through greater value for money strategies. Ensure strict and efficient implementation of the resources allocated to the health sector by implementing open contracting as part of an open government strategy. 4, the full release of the capital budget of the health sector starting from the 2017 financial year. 5, the revitalization of one primary healthcare center per ward, which is a total of 10,000 across the Federation, which the Ministry of Health is trying to do. We consider it as a very noble intervention. But it needs to be executed with a strong collaboration, dedication, and commitment of states and local governments who will eventually run these PSCs. It's imperative for the sustainability of the intervention. And care must be taken to ensure that the FG spending on health is dedicated to issues assigned to it by the Constitution and the relevant laws. The experience of the nurses and midwives hired by FGN during similar interventions under programs like MTSS and SHOP should be brought on board in designing the implementation strategies of the PSC Revitalization Initiative. Essentially, we are saying that FGN, states and LGAs must come up with a clear strategy for sustaining improvements after FGN withdraws its intervention. Although primary health care is not the primary responsibility of the federal government, it should make provisions in terms of resources for grants to states and local governments. Given the fact that the federal government takes more than half of the federation account funds, strong accountability frameworks and practices must be put in place to ensure efficient utilization of approved funds. FG should focus more on development of national health policies and ensure that all the existing ones are fully implemented. FGN should increase its efforts towards a policy and legal framework for sustainable immunization financing. We can't continue depending on donors. Nigeria should be able to pay for itself in the medium to the long run. The full funding of the national rollout of the integrated community case management for malaria, pneumonia, and diarrhea, the 3 biggest childhood killer diseases in Nigeria. We're expecting a full funding for this. Of course, public-private partnerships should be backed upon to fill the funding gap, but should be done in such a way that we don't price healthcare out of the reach of the ordinary Nigerian. Also, alternative innovative funding mechanisms should be explored. There is nothing stopping the federal government and the states from initiating compulsory universal health insurance scheme that will benefit all Nigerians. Of course, we expect the Ministry of Health and the parastatal funding to fully embrace civil society organizations in their planning and programming for the health sector. And finally, we expect that the specific contribution of development partners should be clearly identified and possibly captured in the budget. This is for the purposes of transparency and accountability. And as you can see from page 16 down to 18, the list of organizations that have so far signed up, although there are so many of them that are yet indicating interest, to the contents of this memo. So ladies and gentlemen, once more thank you. We will open the floor for your questions and comments, which the table will take before we call it a day. So thank you, and the floor is open for your questions and comments.